All right, it's 6:49 here this morning. We're going to talk about some issues with your health. This morning we're talking about an ever-growing problem with childhood asthma. Dr. Teresa Bratton with the Guilford Child Health Clinic is with us. Good morning.
Good morning.
Good to see you with us. Thanks very much for your time and coming in on a holiday morning like this. Are we starting to see more kids dealing with asthma these days?
We've seen a progressive increase since starting maybe in the 40s or 50s.
Really?
But
Okay.
it's actually plateaued in the last 10 years.
Okay, so that's actually a welcome sign.
Yes.
But our numbers are still up. Well, I guess it's hard to compare the environment our kids living in now versus the environment they were in the 40s, right?
Exactly.
Yeah, so obviously we're a little bit better prepared to treat it and deal with it now, right?
We have a lot more things that we can do.
Sure.
Yes.
So what should parents keep in mind?
Well, I think that they have to understand that it is treatable, that if their child is having more than a couple of attacks a week, that they need to be talking to somebody about whether they need to be giving more medication to manage this and keep it under control.
But before they're diagnosed, what kind of things do parents need to watch out for to that little trigger? Man, maybe we ought to get in and see the doctor.
Well, I think for parents, what they see is the coughing, the wheezing, the shortness of breath, particularly if this improves with some albuterol that someone has given them along the way.
Oh, okay, which is a common treatment regardless. I mean,
It's not only a very common treatment, the most common treatment for asthma, but it's the test we use to decide whether somebody may have asthma.
Oh, no kidding. Okay, so if they respond to that, then okay, well that's pretty much what it is then.
Pretty much.
Yeah. So I understand a lot of kids actually grow out of it.
A number of children improve and no longer require medicine.
Okay. Okay.
Yes.
But then again, some people don't, and they have to deal with this.
Well, if you're 2, there's an 80% chance that most of your symptoms are going to go away.
Okay. Okay. So here we are getting started with the school year. Anything in particular that school environment may raise a red flag for you as a parent you need to think about?
Well, the important thing for the school system is to know that your child has asthma.
Okay.
If you're at school, if your child's at school and has an attack, the school needs to know how to manage it. And the school system and a number of us have developed a form.
Great, okay.
Which is called an asthma action form. It's also called the school medication form.
Okay.
To try to know what the child is supposed to have at school to take care of this medication, to take care of these attacks.
Now, are these commonly found in schools now already, or
actually, most of the schools will not have this, but the pediatrician's offices, Guilford Child Health, Moses Cone Family Practice, Health Serve, all of those facilities have been supplied with forms similar to this.
Great. Okay. Good resource to make sure you get there, well, especially here at the beginning of the school year.
Exactly.
Doctor, good to have you with us. Thanks very much for your time.
Thank you very much.
Appreciate you coming in. Guilford Health Incorporated has practices in both the Greensboro and High Point area, and you can reach them at this number, 272-1050.